Hi friends, so in this video we're gonna be discussing muscle relaxants now. So muscle relaxants can be divided into two classes, depolarizing and non-depolarizing. Depolarizing and non-depolarizing. So depolarizing muscle relaxants, there's only one there, and that's suxmethonium. Suxmethonium, also known as scopolamine. And then non-depolarizing, they are subdivided into steroids and benzyl lysoquinolones. Benzyl lysoquinolones. It's benzyl lysoquinolines. Like that. I need to buy new markers. So these are the subclasses that you get there, and these ones are again divided into, let's say there's what they call let's say short acting, and then there's intermediate acting, and then there's long acting, right? So under this benzyl lysoquinolines, the short acting there, it's mevacurium. And then the intermediate is atracurium, and cis-atracurium. There is no benzyl lysoquinoline that is long acting. Then when it comes to the steroids, the long acting is pancurium, and then the intermediate is mercurium. And another intermediate under this is rocurium. The way I memorize these, I use an acronym. For these ones, it's PVR. That's the acronym that I use to remember the steroids. And then for these ones, the benzyls, it's MEC. And I know that if I write it like this, M is the short acting, and then these two are the intermediate acting. Then on the other side, the P is the long acting, and then these two are the intermediate. Very, very commonly used drug. Very commonly used drug. Rocurium is the most commonly used drug. So I think it's worth knowing almost everything about it. Yeah. So those are the classes and the drugs that are found in those classes. When it comes to this side, so scoline is not classified as short acting, but they classify it as ultra short acting. Ultra short acting. We are going to talk about it, obviously. So what is this issue? What is this classification, depolarizing and non-depolarizing? What is it based on? So you have non-depolarizing, depolarizing, and you have got depolarizing. Remember, we did speak about depolarizing. Depolarization is when the membrane potential changes. So the inside of the cell, so there's a difference between, there's a difference across the membrane. If this is our membrane, there's now a difference between these two is generated. Remember, if this is the inside of the cell, initially it's negative and the outside is more positive. That's how it is. It's a resting state. Now, the minute you've got influx of positive ions getting into the cell, you are changing from being negative into being positive now. So that's a change. So, and we know that once you get a change across this membrane, you become more positive. That's depolarization. So the non-depolarizing agents, what they do, remember the structure, you've got a neuron, an end plate, and you've got a muscle, and you've got receptors there. That's why that structure was very important. That neuromuscular junction was very important to talk about. It was very important to talk about. So you've got a situation like this here. You've got your presynaptic neuron, your synaptic cleft, and your muscle. So now what non-depolarizing agents do, when they are given, they come in and sit on these receptors, the nicotinic receptors. So they sit there, but they are not agonists, they are antagonists. Remember, an agonist stimulates the receptor, but an antagonist does not stimulate the receptor. So they are called competitive antagonists. Competitive antagonists, because they are competing with acetylcholine. Acetylcholine normally would come in and sit on this receptor. Let's make acetylcholine right. In a normal situation, after acetylcholine has been released from these vesicles, it comes in and sits on its receptor, the nicotinic receptor. That's a normal situation. But now, acetylcholine comes in and finds that, no man, there is someone that is sitting in my place. So now there's someone sitting in my place. and that guy is these neuromuscular blockers. So now acetylcholine does not have a place to sit. So acetylcholine now will be wandering around without a place to sit because the receptor is occupied by these guys. So the word competitive antagonist is that these neuromuscular blockers, they compete with acetylcholine. So they sit where acetylcholine is supposed to be sitting on the receptor, but the difference is that they are not exerting any effects. They are not causing the sodium channels to open, so there is no contraction that takes place. Because if acetylcholine was going to come and sit here, it was going to cause sodium channels to open so that an influx of sodium can take place, and subsequently contraction of the muscle occurs. That's a normal physiology. But now these competitive antagonists, they come and sit there, and I'm gonna make a funny example, guys, here now. So please forgive me for this example. Let's say this is you. There is this girl that you like, you wanna make her your wife, right? I think that's how we used to draw females. So this is a guy, and this guy wants to get to this female. But then this female has got a friend. This guy friend is blocking this guy from this this guy friend is blocking this guy from having a relationship with this girl, but they are not having a relationship. They're not having a relationship. So the presence of this guy in this girl's life prevents this guy from actually having a relationship and have kids with this girl. I hope, guys, you understand that. What I'm saying is, this is the girl. This is the girl, the receptor. This guy, acetylcholine, wants to have a relationship with this girl and actually go on and marry her and have kids and all of that. But now, the presence of this male friend who happens to be a neuromuscular blocker prevents this guy from even getting close to this girl, even though this guy friend is not having a relationship with this girl. They're not having kids, they're not planning to have kids. So that's the easy way I can explain it. Ne? I hope I didn't offend anyone with that analogy, but that's how I wanna explain it. So let me put a better word there. So let's say occupy. So the neuromuscular blockers, they come in, they occupy the receptor, but they just sit there. They don't do anything. They just sit there. They don't cause depolarization. They don't cause sodium channels to open. They don't cause muscle contraction to take place. So there's nothing that they do. They're just sitting there. Now the poor acetylcholine comes in, but cannot sit where it's supposed to be sitting. So that's the issue. So that's how it happens. Now, I think we have to talk about this when we talk about reversing. So what's going to happen now is these neuromuscular blockers are going to sit there, and maybe let's talk about this when we are talking about reversals. I don't want to lose you here. So let's talk about now. So this is how depolarizing agents work. They don't cause depolarization. They don't cause depolarization. They just sit on the receptors. They don't cause depolarization. They don't cause sodium channels to open. They don't cause influx of sodium to go into the cell. They don't cause muscle contraction. They just sit on the receptor. They are called non-depolarizing neuromuscular blockers. And these are the guys that we're talking about. Now, let's talk about depolarizing agent, which is suxmetonium. So, neuromuscular blocker again with a motor end plate with receptors there, nicotinic receptors. Now, very, very, very crucial. Suxmetonium chemically is made up of two molecules of acetylcholine, of a structure that is very similar to acetylcholine. Actually, people say it's acetylcholine. So, because this structure, this suxmetonium is made up of two molecules of acetylcholine, so it is actually acetylcholine. So it's able to cause the effects that acetylcholine would have. So now we know that acetylcholine, when is released from the vesicles, it comes and sits on its receptors, the nicotinic receptors. When that happens is, I want to explain the depolarizing concept. So when you have nicotinic receptors being stimulated, okay guys, there are two terms here. There is an agonist and then there's an antagonist. An agonist is a molecule that sits on a receptor and stimulates the receptor. An antagonist just sits there and does not really do anything. So, acetylcholine on these receptors, it's an agonist. It does stimulate these receptors. It's an agonist. That's acetylcholine. Because acetylcholine in structure is very similar to suxmetonium, so it means that even suxmetonium comes in and stimulates these receptors. So we can say that suxmetonium is an agonist for nicotinic receptors as well, just as acetylcholine is an agonist for those receptors as well, because it does stimulate those receptors. So acetylcholine stimulates nicotinic receptors, and suxmetonium, because it's similar in structure to acetylcholine, it also does stimulate those receptors as well. Now, the important thing is this. I want to explain the depolarizing effect. When you have, let's say this is our bilipid layer, right? Bilipid layer. So, in our bilipid layer, we have, this is our muscle, right? So this is a sarcolemma, which is the membrane that covers the muscle. So this is our sodium channels. So once nicotinic receptors have been stimulated, sodium starts to flood inside the cell. Because it's charged positively, it causes the inside of the cell to depolarize, to become more positive. When this continues, remember the graph, you have got something like this, resting membrane potential, goes in, then because of the sodium channels that open, it shoots up like that. Now it's important to remember the abundant cation outside the cell is sodium, and the abundant cation inside the cell is potassium, right? We've got potassium inside the cell there. We've got potassium, we've got potassium. Now, this influx of sodium causes this this cell to depolarize, meaning to become more positive. Now the body wants to, obviously there's going to be muscle contraction there, but the body wants to maintain a homeostasis. So what's going to happen is that if we are getting a lot of positive ions, if we are receiving a lot of positive ions, then we must take out some positive ions as well, kick them outside. So what's going to happen is that potassium channels are going to open, and when those potassium channels open, potassium is going to be kicked outside the cell. Now you're going to get something like this, which is repolarization, and then it goes down as calcium also gets involved. So what I want to explain is this: once suxmetonium stimulates the nicotinic receptors, you get the influx of sodium. As that continues to happen, because the body wants to maintain homeostasis to bring this back to the resting membrane potential again, so potassium is gonna be kicked out, so that we establish a situation whereby we have less cations inside, because we've got this sodium that just keeps coming in. So because sodium keeps coming in, so let's kick out a positive charge as well, a positive ion, a positively charged ion, and that happens to be then potassium. So as you kick potassium out, this is how suxmetonium gives hyperkalemia. Because the thing is, with suxmetonium sits there and exerts prolonged effects, because it's not broken down by acetylcholinesterase, just like acetylcholine. Acetylcholine cannot have prolonged effects because it's broken down by cholinesterase enzyme. So as soon as it has exerted its effect, it's broken down again. So it doesn't sit for a very long time on the receptor. But suxmetonium is not broken down by acetylcholinesterase. So it's able to sit there and overstimulate that receptor. And that overstimulation of that nicotinic receptor results in a lot of potassium being ejected outside. Now you've got hyperkalemia because of the overstimulation of that. So that's why it's called a depolarizing neuromuscular blocker. So that's the difference. So the difference between these two is that this one's the non-depolarizing, this one is depolarizing, and the reason for that, these ones are competitive antagonists. They are antagonists. They don't antagonize. They just sit there and not have effect. So they don't cause, like I said, contraction of the muscle. But this guy, the crucial thing about suxmetonium is that it has got two molecules of acetylcholine, very similar. So it's able to sit on that receptor and actually have effect. I hope you guys enjoyed that and you understood. Thank you.